You know, if you turn on the news or you read a newspaper, listen to the radio, you're hearing about the cases of COVID-19 being on the rise, especially here in Chattanooga. But what does that mean? A lot of us are still wondering if somebody in your workplace should test positive for COVID-19, what happens next? Well, we hope to be able to provide some answers for you this morning because Lowe Wilkins joins us. He's with the Hamilton County Health Department. Good to see you this morning.
Morning. Thank you.
So, you know, I guess they say that sales is a numbers game, right? You make enough phone calls and eventually you have somebody who says, yeah, that sounds good to me. You do enough testing, Lowe, and we're seeing an awful lot of testing now for COVID-19. Is it just predictable and likely now that you're going to see more positive results, or is this surprising the health department to see this number go up?
I would kind of yield to epidemiology because they kind of basically deal with these numbers on a daily basis. But I would agree with what you're saying. Yes, as you continue to test more of the population in Hamilton County or in any region, I think you will begin to find more cases that are actually present. Yes.
Okay, so let's pick up on what you just said because we're going to talk about what happens in the workplace. That's kind of your specialty. Within the health department, though, you're having very frequent meetings because each of you can speak to specific issues and questions in regards to this pandemic. So if people are watching and they're thinking, gee, Julie, why don't you ask him this? It's because that's not your field.
Okay.
Is that fair to say?
Yes, it is.
Okay, so let's talk about what happens if you are working at a restaurant here in town and a coworker tests positive. What should people expect to have happen?
Well, there's two parts. The individual that's tested positive, and that's because probably they were with maybe a family member or another coworker, or either their social engagement with another individual. Now they've become positive. That individual basically is excused from work and needs to go home for isolation. And isolation means that you actually go home and you go into a room and you stay away from your family members for up to 10 days. And we ask people to isolate themselves for that 10-day period. And within that 10-day period, at the end of that period, we're hoping that you will be completely well and free of fever or symptoms with shortness of breath or cough or headaches. Some people are getting severe headaches or body aches. Hopefully they will be symptom-free, but they have to be symptom-free for the last 3 days. So that period may be longer than 10 days, but it's a minimum of 10. So that person then cannot work, cannot, even if they are essential employee or non-essential, they cannot work because then they will spread the virus to coworkers. So they must basically go home, isolate themselves for a minimum of 10 days and are greater than, because they have to be basically symptom-free for up to 3 days at the end of that period.
But the business itself does not have to shut down, correct?
No, they do not. And so that's the second part, because that co-employee is basically going to, of course, have co-workers. And we're concerned that within a 6-foot circumference of that employee, if people work within that circumference more than anywhere between 10 and 15 minutes, which you probably will with many of your co-employees may work with you over an 8-hour shift within that close proximity, we ask those individuals basically to isolate themselves. But now we go into, instead of the term isolation, we use the term of quarantine. And we ask those individuals to quarantine themselves up to 14 days, because then they also may become ill. They may show symptoms and they may not show symptoms. And some employers are asking those staff members to basically have tests showing a negative result prior to returning to work, but that's at their own policy. That's not the health department's policy.
Okay, so again, back to a business's policy versus a requirement by your organization. If you have someone who tests positive, are you required to disclose that to the public at large?
They do. Many times the employee will disclose this to management, and management may contact the health department, but most of the information comes to the health department from the medical provider. The medical provider will release that positive result to the health department through epidemiology, and then the epidemiology will contact that person with the result, or the medical personnel will as well.
Okay.
And at that time, that person will be asked to quarantine themselves.
I know that the last time you and I spoke, you were happily on talking about the fact that area restaurants were going to be able to open back up, and kind of walking people through how that was going to look. We're watching nationally, as I understand it, up in New York, New Jersey, Connecticut. They're looking to bring those restrictions back, and those area restaurants are going to not be able to open their doors in time for the 4th of July weekend. Here locally, do you feel like people are following the guidelines pretty well? Do you feel comfortable with what you're seeing?
I see many restaurants being in compliance. They're making every effort to follow the Tennessee Pledge and the CDC requirements or recommendations. So I see a lot of people being in compliance, making every effort. There's a few restaurants on occasion that do not follow compliance, and we do consult with those individuals and respond on site to those restaurants as we receive complaints on a daily basis. So, but many restaurants have successfully been able to open and continue to be open for indoor seating and meet the 6-foot circumference requirement for either a group or an individual that goes inside.
Well, and you know, in the business owner's defense, whether it's a restaurant or a storefront, they can be compliant all day long, but if their customers don't aid them in the effort, that's where you can run into some difficulty.
Absolutely, yes. And of course, you can always have a customer come in that's ill, and hopefully they're checking or asking questions as people enter. Basically ask them if they've had a fever or have a shortness of breath or cough, or have they been exposed to someone that's positive with COVID-19. Because if they have, we ask them not to visit that facility until they've basically met their own quarantine in 14 days.
You know, I have to ask you, even if your answer is, gee, I can't comment on that, but I have to ask you, as Mayor Burke looks to try to have Chattanooga become mask mandatory, are those conversations then that filter through the health department, or are they two separate conversations?
My understanding through some press releases by the governor, he will let the health departments make that decision, but I would yield not to. Perhaps Mayor Coppinger and Mayor Burke are talking together cooperatively within the Hamilton County community regarding the best outcome for the community and for public safety. So I will yield to the mayor for that.
Okay, and then one more I'm going to throw your way because it's the mom and me coming out, but you are an expert in the restaurant side of things and making those inspections the best they can be. Do you anticipate that schools will counsel you not so much just for the reopening in general, but what they make their cafeterias and lunchrooms look like?
They have. They're beginning to talk. They've already begun talking with administration here at the health department regarding they have a proposed plan. It's a tiered plan, but I think that tiered plan was originally a suggestion to be modified for final design. And I think the design also is one that can be changed if things become necessary. And so I think that's their current approach.
Okay, and I guess if anyone's watching, do you find that people are afraid that if they should test positive for COVID-19 and tell their employer, they could somehow get in trouble? Is that a concern that anybody has voiced?
I think so, yes. We have heard that before recently. I think people are concerned about the quarantine period or the isolation period, as well as coworkers for the quarantine period, because at that time those people would not be eligible to work. And so sometimes the financial issues are pressing those individuals, and sometimes we don't get full information because of those fears.
So if you test positive, are businesses required by law to still pay you in that quarantine time?
I can't. I will let those private industries speak with that. Okay. There is a lot. There are some new regulations that are recommendations. I don't fully understand them all, and I would hate to make those statements.
I think everybody watching.
I want to give you correct information, and I'm not sure I would give you correct information regarding that.
I was just in the process of saying, I'm sure that everybody watching appreciates the fact, Lowe, that you're saying I'm not the one to answer that. We can certainly understand, because I'm sure that things are changing in your world each and every day, and not one person can possibly keep up with all of the changes.
Yes.
Well, we thank you for your time this morning and all the work that y'all are doing there at the health department to get the word out to us all as you best can.
Yes, and our hotline is still available. Of course, it's 209-8383 if anyone needs further assistance or has questions.
All right. Always good to talk to you, Lowe.
Thank you.
And the regular number at the health department is 209-8088. You can also learn more at help.hamiltontn.org. We are back with more in just a minute.